Hello guys, we're going to talk about adrenal hormone excess in the next couple of minutes. We'll talk about diagnosis of Cushing syndrome and how to do workup. So we'll do 3 questions. Question number 1, we have a young 40-year-old woman. She has unexplained osteoporosis. So she's getting workup in your clinic for unexplained osteoporosis. She does not have any significant past medical history. Her BMI is 35, which is high. She is not on any medication except oral contraceptive. On examination, she has rounded faces, she has thin hair, she has mild hirsutism. Otherwise, her exam is normal. You check her CBC, which is normal. Her complete metabolic profile is normal. Her vitamin D level is normal. Her TSH is normal. Which of the following is the most appropriate next step in evaluation? So in this patient, we are suspecting she might have Cushing syndrome, which is causing unexplained osteoporosis, obesity, and mild hirsutism. Option A, check random serum cortisol measurement. Option B, check ACTH hormone measurement. Option C, do 24-hour urine-free cortisol level. Option D, check 8 milligram dexamethasone suppression test. So here the right answer is option C. We will check her 24-hour urine-free cortisol. I'm going to explain this. Why did we pick this screening test? First, let me explain you option A. Random serum cortisol level, they lack sensitivity and specificity because cortisol has pulsatile release. And we don't check 8 a.m. cortisol level for screening of Cushing syndrome. We can check for adrenal insufficiency. So random or 8 a.m. serum cortisol level has no role in the screening or as well as diagnosis of Cushing syndrome. Now, option B, ACTH hormone, and option D, 8 milligram dexamethasone suppression test. This we would do once we have biochemical evidence of Cushing syndrome. So far we have not made the biochemical diagnosis, so these options are incorrect. I'm going to explain that in next couple of minutes. So if you are suspecting patient have Cushing syndrome, you can do 3 tests. Okay, now we suspect Cushing syndrome if patient have right clinical findings. So our patient had obesity, osteoporosis, hirsutism, so it's reasonable for her to have screening for Cushing syndrome. So the 3 tests are: First test is 24-hour urine-free cortisol level. Now this test is very sensitive. Now if you collect 24-hour urine-free cortisol, if it is more than 3 times upper normal limit, that confirm that patient might have Cushing syndrome. That's test number 1. Test number 2 is overnight 1 milligram dexamethasone suppression test. Very simple test. In this test, we gave 1 milligram. We asked patient to take 1 milligram dexamethasone at 11 p.m. At 8 a.m. or 7 a.m. we check their serum cortisol level. It should be very, very low. It should be less than 1.8. Now, what is late night? The third test which we can do for screening of Cushing syndrome is late night salivary cortisol. So let's talk about this test. So when we sleep around 11 p.m. or around midnight, our serum cortisol level physiological is at the lowest level. Now patients who are obese, who have depression, their level also should fall late night. Now patients who have a Cushing syndrome, their level goes high at late night. So in this test, what we do, we ask patient to collect saliva around 11 p.m. or around midnight, and cortisol can remain on saliva for a couple of hours or a couple of days. This test is least invasive and it's pretty accurate, and patient can collect saliva at home. Okay, so question number 2. So our patient who was having osteoporosis, obesity, mild hirsutism, You check her 24-hour urine free cortisol level, it is 600, which is pretty high. Normal range is 30 to 145, so it's almost 4 times upper limit. So this test is positive. Her 24-hour urine creatinine is within normal range. So this is very, very important. Whenever you order 24-hour urine test, you should always order creatinine to check the diagnostic accuracies, to make sure patient has collected adequate sample. So this patient has collected adequate sample. Her urine free cortisol level is 4 times upper limit. So this test is positive, and she has a clinical feature of Cushing syndrome. So what would you do? Option A, check ACTH level. Option B, check midnight or late night salivary cortisol level. Option C, corticotropin releasing hormone stimulation test and high dose dexamethasone suppression test. Option D, do adrenal CT scan. So here the right answer is option B. We will do late night salivary cortisol level. Now, if you are making the biochemical diagnosis of Cushing syndrome, patient needs to have 2 abnormal tests before you go to further step. Our patient has only 1 abnormal test, so we have to do 1 more test. And once if patient have 2 abnormal tests, then you can go to next step. Because the diagnosis of Cushing syndrome is very, very expensive, so you have to make sure you confirm the biochemical diagnosis of Cushing syndrome before you try to find out whether patient have central Cushing disease, ectopic ACTH production, or adrenal ACTH production. So option A, option B, and option D are incorrect. We won't go, we are not going to look for ectopic or central ACTH producing tumor. We have to confirm the biochemical diagnosis of Cushing syndrome. So you have to do 2 tests, okay? So let's go back to our slide. So if patient have 2 abnormal tests, you have a biochemical diagnosis of Cushing syndrome. And the first step you want to do is you want to check serum ACTH level. So that's what we're going to do. So we have checked her 24-hour urine cortisol, which is abnormal. We'll do late night salivary cortisol level. And if that is abnormal, patient have a biochemical diagnosis of Cushing syndrome, and then you check ACTH level. Let's do question number 3. Our patient 24-hour urine free cortisol is 600, which is very high. Her late night salivary cortisol is abnormally high. So she has a biochemical diagnosis. So you do ACTH level, it is only 2, which is very, very low. Normal range is 20 to 80. What would you do for her? How do you confirm the diagnosis of Cushing syndrome? So option A, do an adrenal CT. Option B, do MRI of the pituitary gland. Option C, check corticotropin releasing hormone testing. And option D, do inferior petrosal sinus sampling. Here the right answer is option A. We will do adrenal CT scan. This patient is having ACTH independent Cushing syndrome. So the most common cause is adrenal. So you will do adrenal CT scan to look for adrenal adenoma or carcinoma. Now, MRI of the pituitary gland, corticotropin releasing hormone, or inferior petrosal sinus sampling we do if patient have Cushing disease, which is central cause of ACTH dependent Cushing syndrome. This patient have low ACTH, so you want to do adrenal CT, okay? Now, if you do adrenal CT, if she has bilateral adrenal hyperplasia and if she have borderline high ACTH, then she has ACTH dependent cause, okay? So most likely this patient is might show adrenal adenoma or carcinoma. So let's go back to our flow chart. So if patient ACTH is less than 5, most likely patient have adrenal cause of Cushing syndrome. So you do adrenal CT. So with this, we are done with diagnosis of Cushing syndrome. In next couple of minutes, I'm going to talk about how to make a diagnosis of Cushing disease, that is central causes of ACTH dependent Cushing syndrome. We will also talk about ectopic ACTH production, which can happen in lung malignancy. So I'm going to stop it here. Thank you.